coming up around the corner. So what a few things that are new since last week that we should talk about, and then we'll open it up for questions and discussion. So case counts, case numbers, how are we doing? Well, in North Carolina, there's still a slow but steady increase in number of cases and also in hospitalizations. Many of these seem to be concentrated in and around Mecklenburg County, Charlotte, and the Raleigh-Durham area. But I will say that probably every county has had a slow but steady increase. Here in the Triad, actually over the last week and a half, following 2 to 3 weeks of daily number increases in numbers per day, I guess is the better way to say it, we've actually steadied out some, and it really hasn't changed a lot. So as far as cases reported through public health to the state in Forsyth County, it's been running roughly between 50 to 70, which is no different than it was last week, and maybe even down a little bit than it was from the week before. Hospitalizations are also down modestly in our region here, but other areas of the state are seeing increases, and that's what has led to those numbers. It also led to, as most people know, we're on the list, right, for having to quarantine if you're going to New York, New Jersey, or Connecticut. Will other states follow through with that? I don't know. But what is that going to mean? We'll talk about that in a minute when we talk about summer travels and summer vacations, which is probably the #1 question I get asked now. But anyway, we're on that list. We're not as bad cases per 100,000 people as some other states, but there are a lot of other states who are doing better than us also. Because of these cases that are slowly increasing, particularly in our larger communities, that has led to a delay in moving to phase 3. I think that was wise, we certainly don't need increased risks and chances of large clusters and super spreader events occurring. The big things that moving to phase 3 would have been risky involve certain businesses where social distancing, personal distancing, and masking is difficult, and then also large gatherings. And large gatherings are a risk, really, no matter how you do it. So I think that holding back until we can get a better handle on what's going on and start to push things back down again, that delay into phase 3 is wise. The other thing that's new and different has to do with what we've been talking about for the last 2 weeks, right? Face masks. So we now have a mandatory order for face masks here in North Carolina. The big thing with the face masking, when you really read the order and you get down to it, is the face masks are required when you can't be more than 6 feet away from a person, and be that outside or be that inside, it doesn't really matter. So if you're in a store and you're shopping, you're going to wear your face mask because it's just too hard to not be within 6 feet of a person in a lot of these areas. And then outside, it's crowded places, greenways. If you're in a queue waiting to get into a big box store and the sidewalk's busy, for instance, and these are the places where masks are required. There are some exemptions, and I know some of this has been reported in the media, so I won't go through the entire list. But one is that if you have a medical reason that you can't wear a mask, and what might some of these medical conditions be? Well, some of them have to do with lung disease, chronic lung disease, people who require oxygen and portable oxygen, for instance. And even though I've seen people with portable oxygen find a way to do it, and so, people who have severe claustrophobia, where they get anxiety, panic attacks in masking. Children under the age of 11, I believe, is the age, don't have to. People who have certain disabilities, where particularly disabilities that affect insight or developmental disabilities, for example, where wearing a mask just isn't going to work, and they're also exempt. So the exemptions are on the honor system. If you read the fine print in the notice, which means you don't need a letter from a doctor for exemptions. We're already getting phone calls about that. Can I come in and get an exemption letter? You don't need an exemption letter. You don't need documentation. It's on the honor system. That means that we need to be responsible and do this. So why are we doing this? It's basically so that we can reduce viral transmission by holding those respiratory goblets to ourselves rather than into the environment and to other people. And if everyone did this, and I don't think we're ever going to have to move back to phase 1 again, or phase 0, so to speak, when we were all sheltering in place. I think it'll work. So personal distancing, masking, frequent hand sanitizing, washing your hands. I think that's the key to being able to stay open. And so we'll see how it goes, but everyone has a personal responsibility for that. So another thing is that recently we've become aware of cluster exposures for people involving large groups of people, parties, so to speak, social gatherings. I know everyone's starving for those social interactions, but getting large numbers of people together, particularly indoors in closed spaces, is just not a good idea. And when we've had exposures in these settings, in other words, big party, 30 people together in a room having fun, no social distancing, having a great time, and then 24 hours later one of the people in those party gets sick and gets tested and has COVID. So that creates problems for that whole group of people who were in that party. And then with the contact tracing and everything, in most instances, all those people are going to be quarantined. So if you got a bunch of people who say all work together, hey, we all work together at Widgets Inc., and we're going to have our big company 4th of July party, then you could shut down Widgets Inc. if you have a case in that setting. So it's just not a good idea. So what can you do? What can you do to have some social interactions that are safe? First of all, limit the numbers. Keep them down. Do it outdoors. Personally distance. Wear masks while you're doing it. So if you want to have a backyard barbecue with your neighbor, you can do it. But keep the numbers down. Be responsible, and keep it outdoors in the nice weather. And if you're within 6 feet of each other, you're going to have to wear the masks. So you can do it, but you just have to be smart about how you go about doing it. With the 4th of July coming up, I know a lot of people like to have picnics, company get-togethers, social gatherings, but the fact is, most of our workplace cases that we've had and introductions of the virus into workplaces, and I can think of 15 places right now in our Triad area where this has been the case, The actual exposures were outside of the workplace. And so either in a household or a social gathering. So enough said about that. I think people get the idea. What about summertime travel, vacations? So, there's no, technically there's no, solid rules for this. But a lot of it comes down to common sense. Now, you are going to have to look up where you want to go and find out if you're going to have to quarantine when you go there. There are both state requirements for quarantine for entry, and there are also some local requirements, counties and even cities and municipalities. So before you travel, look it up and see whether they're going to require you to quarantine when you come in. So I'll just give an example. Right now, New Jersey, New York, and Connecticut, North Carolina is one of the states, because of our case numbers now, that you would need to quarantine for 14 days when you go in. Does that mean you can't go? No. It means that you're supposed to be quarantining after you come in, which means staying home, basically. Shelter in place. So I've been asked questions, and I'll pull up a few of them just as an example. So I'm supposed to go up and help my daughter move from one apartment to another in Queens. Can I go? Well, yeah, you can go, but quarantine. You can do the moving stuff and wear a mask in between, but let's not be clubbing. Let's not be going to restaurants and or out and about. Other people saying, I'm supposed to go to a wedding in Connecticut. Can I do that? Well, no, you're supposed to be quarantining. So being in a wedding means you're out, you're in a group of people, and that would be against the rules. So when you look at New Jersey, New York, and Connecticut's rules, there actually are fine stipulations that if you are, quote, caught outside of a quarantine situation when you're supposed to be doing that. And they're substantial. I think the first offense is $2,000, which that's a chunk of money. And so how are they going to be enforcing these? The devil's in the details here. I think a lot of it is still going to be on the honor system. And we'll see how it develops, but maybe when you're leaving, deplaning the airplane, you may be required to sign in an attestation that you understand and you know about this. They'll be taking cell phone numbers, I believe, probably, guessing. Will they be tracking your movements? I would guess not, but if you would find yourself in a situation where attention has been given to you and you're not in a quarantine situation, you could be fined. So in other words, you're driving and you get stopped for speeding and you show your North Carolina driver's license, you're going to get a talking to at least about that. So look it up before you go and figure out how you're going to do it. And for some of the states that require quarantine, maybe it's best to delay that travel and just not have to deal with it. So what I would say is let's see if we can make a list of safer activities for vacation travel and less safe activities for vacation travel. So safer activities, avoiding large geographic areas where there's a large number of cases. So there's certain cities and certain states which are having more of a hard time right now than others. So that would be less safe. Going to a place that's not having as many cases, so would be more safe. Visiting family who you know something about and you know what they've been doing and or not doing would be safer than going to rallies or where there's crowds of people that you don't know, large parties, going out, so on and so forth. Staying in your own, in a rental property or your own property if you have it, is probably safer than staying in crowded hotels or motels. So driving is going to be safer than flying. So you put it together. So driving to your relatives' houses to visit your daughter and granddaughter, for instance, in Virginia for a week is going to be safer than going to DC and having a big tourist experience. So, and so on and so forth. So you can kind of assess your activities. What you do is actually more important than where you do it. So, you know, a lot of people say, well, where's the hot spots? It's all about geography. Should I quarantine after I come back from any of these hot spots? It's more important what you do there, right? So if you go to Queens and you stay with your, you know, new grandbaby, and you basically stay in the house, get takeout, do what you're supposed to do, that's low risk. So when you come back, it's probably not any more risk than living here. But I think people can understand what the higher risk activities are. So it's basically number of people, length of time exposed to people that you don't know about, and not being masked. And these are the things that would be a problem. So with that, I think last week we talked a little bit about treatment and steroids. A lot of our hospitals in our area now are starting to use steroids, and particularly in our ICU patients. And I think that actually makes sense to try to reduce the inflammation that's associated with the viral infection. Vaccine development continues to progress. I still think this time next year, with a little bit of luck, hopefully we'll be figuring out how to give it and who to give it to, and maybe even have started giving it. Tony Fauci said this week he thinks maybe early 2021. I think that's possible, actually. But there's always can be a hitch, but so far so good. That's been encouraging. With that, I think I'll go ahead and open it up for questions. I may not have covered everything, but you can think of it.
Dr. Earl, we could talk about mask use because the mandate's starting tomorrow. There might be people who might be new to the mask wearing operation. So would you mind to tell us how to properly wear it?
Yeah.
And then where do you put it?
Yeah, okay, how do you wear a mask and where do you put it? So I have a mask, my mask, has the strings on it. Some of the masks have ear loops, which are actually a little easier to use because you can just flip it in behind your ear. I don't know, I'm used to strings. I've been doing this as a doctor for a long time. So you put the mask on like so. You tie it up behind your head or you loop it around your ears. But you got to get it over your nose. Okay, and being over your nose is important because there's virus behind the nose. And then the other thing you want to do is make sure your mouth is covered, okay? And then you put this back here. You want it to be a little bit tight on the edges, but it doesn't have to be real tight. So it should be comfortable. Once the mask is on, it's best not to mess with it. Until you don't need it. So let's say you're going into the store, you put your mask on, you go into the store, you wear it in the store, and then after you come out of the store, you're walking across the parking lot, there's no one within 20 feet of you, you're going to your car, then you can take the mask off at that time. Hand sanitize before putting the mask on, hand sanitize after taking the mask off. So we call that wash in, wash out. Hand sanitize before going in the store, hand sanitize coming out of the store, for instance. You can put that rule out for a lot of things. So that's the right way to wear a mask. Believe it or not, you do get used to it. As time goes on, it's a little bit hot, but indoors it's not usually so bad. So taking the mask off is basically just the opposite. You know, you pull the strings, and then you hand sanitize, which I don't have any up here, but if I did, that's what I would do.
If I'm going about my day, do I put it in my pocket? Can I put it in my pocket, put it in a purse, put it in a bag, reuse it? How often, that kind of thing?
Yeah, you can put it in your pocket, you can put it in your purse, you can put it in a bag. I usually, when I'm out and about, I hang mine from the rearview mirror of my car, but that's all personal preference. So you can do that, you can store it. You should wash it, you know, fairly frequently. Most people would want to do that anyway, it just makes for a more comfortable experience with it. So
in the governor's orders, there are a lot of exemptions and exceptions. So especially with going with the honor system, do you feel like this mandate can be effective?
do I feel like the mandate can be effective with all of the exemptions and exceptions and being on the honor system? Yeah, I do think it can be effective. For one thing, I think it's people realize that, you know, now they're being held to it. It gives that level of politeness a certain backbone to it, so that people understand they're supposed to be doing this. This is supposed to be the behavior. And if they're not, they could be called out on it. I think certain businesses have always wanted to, you know, have people wear the mask coming in, because to tell you the truth, a lot of the workers would prefer that you be masked. I know I've talked to a lot of businesses that, you know, have a customer facing in stores, and they're frustrated that people aren't masked when they come in, because they feel like it's risking them. But they feel like they don't have the ability to call them out on it. So a business now can put a sign up here, you are required to wear a mask coming in here, and it's backed up. While it is on the honor system and enforcement, there's not going to be a police force out looking for people without masks, you know, out at Tanglewood or something, for instance. But if you go into a store and the store asks you to put a mask on or leave, and you don't do it, they very well easily could call law enforcement, and you will be cited, and that's clearly written in the thing. So it gives a little bit of backbone to, I think, what people would rather have anyway.
Is there anything that you would change about that mandate?
Anything I would change about the mandate? I think that you know, at this moment, I think it's a good start, and so I would say no at this time, and we'll have to see how it goes.
Back in February and March, there were signs from the CDC and messages saying to hold off on masks. It's not, you know, mandatory or recommended. Do you think that hurt us in the country and also North Carolina? So should this mask mandate happened earlier?
So the CDC said early on, yes, masking may not be necessary, let's hold off. They did say that. And so what's happened? Why is it different now? Well, one is we have a lot of more studies that show that they really do work. And I think last week I mentioned, but I'll bring it up again, that one of the ones that I thought was really impressive was that at a hair salon in Arkansas, like most states require people who cut hair to wear a mask. There were two stylists who had COVID and came to work ill the first 2 days before they had sorted out that they were sick. They wore masks, and of the 81 people that they cut hair, which would be a significant exposure, right? I mean, people are close to you for more than 15 minutes. None of them got COVID, and so the masks made a difference. And so that, I mean, that's just one example. So one, the data is much better now. That masking is really going to help. And then the second thing is that we have more masks. at the very beginning, the cloth masks weren't really out yet, and we didn't want people taking the surgical masks and N95 masks away from healthcare providers who really needed it. And so now that we have more PPE available, that's not as much of an issue. So it's that we know more and we have more is kind of what it comes down to. Should we have been doing it earlier? In hindsight, yeah, maybe. Yeah, I think it would have helped. But we didn't know, and so you make your recommendations on your best science and data.
The people on listening and on social media who's saying there's just so much sometimes back and forth information, they feel misled, they feel misguided. Now you're wearing masks, but they told us not to earlier. What do you say to the people?
Yeah, well, so the social media people, hey, I've been misled or I've been misguided. Well, that's not really the case. I don't know, I'm trying to think of an analogy. I mean, if all of a sudden you start to know things that make a difference, you would institute that, right? So, I mean, you would do that even in your own life. If all of a sudden you realized that using a certain appliance in a different way extended the life of the appliance and made the appliance safer and easier to use, you would institute that once you knew about it, right? So it's sort of that same thing. No one was trying to mislead. I guarantee you. I know that for a fact. So it's just when we learn things that help, that we change our behavior to implement those things. So. We learned cigarette smoking wasn't good for our health. So a lot of people stopped smoking. We have stop smoking campaigns. You go back to the 1940s, some people thought it actually improved their health. That was wrong. So we learned something, we changed our behavior. A lot of public health is that way, is behavior change based on what we learned. The other thing about masking sometimes that I hear, and that's come out on social media, is that some people think wearing a mask is unhealthy, and it's not, actually. So I've heard that, well, you put a mask on and it keeps your CO2 and you rebreathe your own CO2 and you'll get headaches and CO2 poisoning and things like that. That's just not true, because the way these masks work, the CO2 is expelled and leaks out. It doesn't get rebreathed. To rebreathe CO2, you need a pretty fancy mask, which we sometimes use in healthcare, but that's not the case for these. The other thing I've heard is that, well, putting the mask on and taking it off or messing with my face and adjusting it actually increases my risk of getting COVID. No, really no, that's not true either. Again, the mask is to keep you from giving it to other people, more so than to protect yourself. What other myths have you heard about masks? And we can talk about it. But I think those are the two big ones, is that it's not unhealthy. I mean, we know that. I mean, surgeons wear a mask all day, right? They're operating. And so I think we don't have a lot of unhealthy surgeons walking around. So they're not an unhealthy thing. So.
Implementing a mask mandate at the end of June, is there still a chance that we can reverse course in North Carolina, or is it too late?
Is there a chance that we can reverse course in North Carolina by wearing masks? Yeah, I think there is. I think actually the chance is better than not that we can. And I mean, think about it. A lot of places that were really having a devil of a time in April did a full, shelter in place, like New York. Okay, their hospitals were full. They were turning conference rooms into ICUs. I mean, it was bad. And they put their shelter in place, and that pushed down the curve. It worked. We pushed down the curve here in North Carolina. I mean, our numbers are back up like they were before we pushed it down, but we pushed it down. So if you think about masking and personal distancing as being an alternative to shelter in place, which I think it is, then we should be able to push the curve back down again. I think it'll work. I really do. I'm pretty confident about it.
How much of this curve being pushed down again is on the individual person?
Yeah, so how much of the curve being pushed down is on the individual person? A substantial part of it. That's where the personal responsibility part comes in. And, and we talked about last week that, some people say, well, you can't interfere with my rights. It's a constitutional right for me to do what I want to do. And so that might apply, to what color car you buy. But when I don't think it's your constitutional right to expose other people to an infection or a disease. And in public health, I mean, we actually have laws about that, quarantine laws. So we can implement those, and that's something that's been going on for centuries in developed countries. So it really is your responsibility to be part of the whole community and trying to reverse course for what's going on with our cases here.
Speaking of personal responsibility, some more, there's still a decent sized segment of the population that I guess at this point refuses to believe this virus is real. They'll say things like, I don't know anyone that's had it or anyone that's died from it, so it must be. Is there anything that you can say that would just make people?
Yeah, so there's a substantial group of people. The question is there still seems to be a substantial group of people who don't really believe that this is a problem. Either they don't believe the virus exists at all, or that it's not really a big problem, and that they don't. I've never met anyone who died from it, and I don't know anyone who's had it. So actually, when you really get into it, they probably do know somebody who's had it. They just may not be aware of it, because there's enough people now who've had it. I mean, in our area here, probably about 5% of our population have had COVID. So when I meet people who are visiting their parents in the ICU, those people believe it. When I meet people who know a coworker who's gotten it and was out for a week and a half, 2 weeks, maybe in the hospital, and when they come back and they're still, trying to recover and get back their function, they know that. I mean, they believe it. Eventually, these people will all know somebody who's been affected by it. So this can also be a little bit of a subconscious thing, and this is one of the things about the parties and people getting together. They don't, it's funny when you talk to people who've been in an event like this, and they say, my gosh, that really wasn't smart, but I just never thought it would happen to me and my friends. And as you see across the United States, the people who are getting COVID now, the middle-aged and older people, the numbers are steady or going down, actually. It's the young people who are really getting it now, and the data is clear, particularly in Florida and Georgia and some of these other places. I haven't looked at it yet in North Carolina. I would, but I think it's probably the same there. So young people tend to think they're immortal, and it's like, hey, this is not going to happen to me. This is something that happens to those guys, on TV, or those things that I hear about, and so that's just not true. COVID's everywhere, and COVID affects young people just as much. And even though most young people, recover and do okay in the long run, not all of them will. Small numbers, but it's not. So it's still a risk, and so I mean that's what I would say. I mean it's a good question, but everyone will eventually be affected by COVID.
I was going to ask. You talk about how North Carolina cases have gone up, and you said there are more younger group. But is it right that although that's happening, the actual deaths are staying stable or maybe coming down?
Yeah, so our cases are going up, but our deaths seem to be staying stable or going down. So that's a complex thing. One is that deaths lag behind. Case increases by about 3 weeks, maybe 4, because the process before death takes time. And then the other thing is that yes, some of the populations that are getting affected are younger, and thus don't have the mortality, but they do get hospitalized. So our hospitalization numbers are going up. And then the nursing home outbreaks, we've gotten a little better at controlling these, so there aren't as many really vulnerable people getting it in those settings. We still have further to go, but it is getting better. So so those, I think, are some reasons why the deaths are down a bit. But we need to keep an eye on that, because they will go up, I think, in a couple, 3 weeks. How much, I don't know, but hopefully not like what it was in April.
With the sort of, like we just talked about, people kind of in denial, the virus has sort of become a political issue at this point. Is it a stressful time to be in medicine, to be an infectious disease expert?
Yeah, well, that's a good question. I appreciate your personal question. They say, the virus has become a very political issue. Does it make it a stressful time to be in medicine or an infectious disease expert? Yes, it does a bit. It's really hard for me to understand why politics should even matter in this. I mean, as an ID doctor, it just doesn't make sense to me. It really doesn't. And I understand it has, but if you ask me in 20 years, did it ever make sense that this was politicized? I'd say no, it never made sense to me at all. It's very discouraging. It's extremely disappointing, because I know what will work and what will help. I know we could be more like Europe. I mean, we could be. Right now, Europe's like opening their museums back up, and their cases are down enough so that if there's a cluster, they can jump on it and contain it. We could be that way. We could do that. I mean, here in the United States, we got a lot of resources. We got a lot of smart people. We could do that. But the first step is to get rid of the politics. And then we can move on and do what we need to do, and we can trust science, we can trust public health, we can trust our doctors, and do what we're supposed to do, and we could be like Europe. It doesn't have to be this way. So yeah, frustrating. It is.
Going off of that, there are everyday people who are saying that this is amped up because it's an election year, and that what else is the CDC or the National Institute of Health hiding from us, and we feel tricked.
So what is the CDC and the NIH hiding from us to make us feel tricked? Really nothing. I mean, I don't know of anything that's being hidden. When you politicize something, sometimes one of the side effects of that might be that a certain agency or group of people may not be able to, release all the information in the way that they normally would have done it, and it has to be vetted and go through different pathways, but it's not being withheld. And I know there was a question where, we deliberately slowed down testing. I don't know where that, I do know where that came from, but it's not true. I mean, we haven't. I mean, our testing continues to increase, actually, so. So I think people can be, I think people need to trust science, and they need to trust their public health agencies, and they're not trying to pull something over on us. I would know if they were.
Just to be clear, obviously the more people you test, you'll probably uncover more cases of the virus. But just to be clear, when the president said slow testing down, that's what he wants to do. Just to be clear, that's not a good thing.
Yeah, so the president said, I've said that we're going to slow testing down. He was kidding, right?
Well,
So,
no,
yeah,
the next thing he
but,
said, I don't
right. So I'll give him the benefit and let's say he's kidding. It is still not a good thing to do, and it's not a good thing to joke about. No, slowing testing down would not be a good thing to do. We, there is a little bit of a potential for testing to take on a life of its own. And what you need to do is when you do a test, you need to make sure that the results of that test have the most impact as possible. Okay, so that means that if it's a positive, you can track down the people who had it, do the contact tracing, get quarantine in place, get isolation in place, and build a cocoon around that person and the people that they were in direct contact with, particularly the household. And that's effective testing. Testing that's not as effective is, saying, well, I feel fine, but I'm going to go down and get a test just to make sure I don't have it. And then when it's negative, they say, wow, it's negative. Now I don't have to worry about COVID. I mean, that's not effective testing because you still do. I mean, it shouldn't change your behaviors. You still need to mask, still need to personally distance. The test doesn't. So so there is a bit of a risk of getting too wrapped up in the test. But when the testing is done in conjunction with effective contact tracing, quarantine and isolation, that's how we would like to keep this in check. We're probably going to have to push the curve down a little bit in order to get a handle on it, to do it that way. But you can. It does work. That's known public health measures. It works for COVID. It works for TB. Works for meningitis. Works for whooping cough. I can go down a whole list of communicable diseases where testing and contact tracing, quarantining, and isolation works.
Thank you.
Yeah. Any other questions? Anything come through the comments or the chat line?
A couple people are wanting to know how you keep glasses from fogging.
How do you keep glasses from fogging? Yes. Well, one, you could wear contacts, which may not be possible for everyone. Two is wash your glasses with soap and water. And actually the soap film on it helps prevent the, so this is a trick docs know, and nurses in that. And there's also anti-fogging solutions you can get, and those are available commercially, that people have used. And I used to wear eyeglasses, and I lived in northern Wisconsin growing up, and I tell you, my glasses fogged constantly, and that defogging stuff, the anti-fogging stuff, really works. It works great.
How often should we wash masks, and how should we wash?
How often? Well, if it looks dirty, you should wash your mask. If it smells bad, you should wash your mask, and probably at least once a week. They say 20 uses, something like that. And once the mask gets worn and frayed, get a new one.
Thank you.
Yep. Thanks. See you next week.